This week we're in Chapter 5, Measurement Measures, Measurement Instruments, and Sampling. So at some point, you're going to have to consider how you're going to handle data related to your project. This may, and it begins as soon as you see a need to report data and to interpret that data. This could be part of your rationale where you're trying to present evidence that supports the need for a particular study. Well, that may be based on a preliminary data analysis. So you have to find a way to take a data set that just has raw data in it and analyze it in a way so that the results that are outputted can be interpreted to say something about the data as a whole. So if we look at the definition of measurement, so the first thing I want to point out is applying numerical or narrative data. So again, the example I like to use is at the end of each semester, you're asked to complete a spot or a student perception of teaching. It's basically an evaluation on me and the course. And that instrument, the spot, collects numerical and narrative data. So it'll ask you to assess or rate quality of instruction on what's called a Likert scale. A Likert scale, probably you're familiar with it. You may not be familiar with the name, but anytime you ask a question, how would you rate the quality of I don't know, let me see how what kind of wording it would be. Indicate the level of agreement you have with our question said, or our statement says, this quest or this course is of low quality. And then you go to the Likert scale and you'll see several possible choices, from strongly disagree to neutral to agree to strongly agree. Scales that have you respond by selecting how much you agree, how difficult, how much you enjoy. Anyway, there's multiple selections that you can make, and depending on if it's agreement, your level of agreement, then you would select that. Now I'm going to come back and talk about Likert scale several slides from now when we start talking about data types. But you want to approach data right now as numerical value, because that's what I use, that's what I'm comfortable with. The narrative part would be on that same spot. Any comments you want to include with your submission, says you would actually type out sentences and things like that. At that point, you have to decide, okay, what am I comfortable with analyzing and evaluating? Narrative data uses a little bit of a different approach. Again, we'll talk about that at some point. But as far as measurement's concerned, we're going to include numerical and or narrative. We collect data using an instrument. So in my example, that would be the actual spot exam, be the questionnaire, the survey, anything that is used to collect data. So an instrument could be a blood pressure cuff. An instrument could be a scale that you step on to get your weight, right? So not only do we need to be concerned about what data we're collecting, but we also need to consider the utility and the quality of the instrument that we're using. Now, how do you go about doing this? So identifying the instrument or tool, right? So based on your level of familiarity, you may already have some instruments in mind that kind of fit in with what you're trying to measure. If one doesn't exist, then we need to start to think about, well, do we need to create a new instrument? And that's a whole nother can of worms that we'll talk about. But at some point you have to understand, okay, what am I using to collect data? Determine how the data will be categorized using numbers or words. This is if you need to recode your data or compute a new variable, but you may have a situation where you collect age, right? Person actually types in their age, and you think, okay, well, I'm mostly interested in um, 17 and younger and 18 and older. Well, then you need to come up with a strategy that you're going to use to create a new variable, and we'll just label it as adult. So depending on what the person entered in as their age determines which category they're going to be in. Sometimes it's advantageous to use categories. Again, you just have to rely on kind of your familiarity with what it is you're trying to do. Deciding how categories will be classified. In some cases you may have nominal categories where they're just simply based on some descriptive characteristic. Could be, okay, maybe you have red, blue, green, yellow, and you asked a question in the instrument, what's your favorite color among these four? And depending on whether or not a person, what they answered, if they answered red, then they go in the red category. If they answered blue, they go in the blue category. That's nominal. There's no value difference between red, blue, yellow, and green. Or you may select what's called an ordinal category, where there is a difference, but you don't know exactly how much of a difference. Maybe you have a response scale that assesses education level. Maybe say high school diploma or equivalent, some college, AA degree, bachelor's degree, master's degree. And again, depending on what the person answers, that determines the categories, but you could rank order those categories. You know that a high school diploma is less education attainment than a bachelor's degree. Quantitative and qualitative. Okay, so we can go all the way back up to the top. So numerical data would be quantitative. That narrative data would be qualitative. So again, you have to understand, what type of data am I collecting? What type of data do I want to collect? How am I going to analyze the type of data that I collect? Okay, so why is this important? Measurement is really going to be the yardstick that we measure how well our program performs. So not only does a health education specialist need to be familiar with data collection, they also have to be familiar with, okay, knowing what they are collecting, what type of data, how they're going to use that data, what's the appropriate analysis based on data type, and what we need the data to tell us. So we need to begin with some questions. What are we trying to do? That's going to help us identify what instruments will collect the appropriate data. It'll give us some insight as to what the statistical analysis needs to look like in order for the results to tell us something related to that research question that we're after. So either you need to be able to do these types of things, or know someone that can do these things, but you cannot escape data analysis and data collection when you're putting these things together. Okay, so what are some instances where you would need to collect and analyze data? Well, when you're putting together your rationale, remember, you're selling this idea that there's a need for the program. How are you going to demonstrate need? Well, you're going to demonstrate it through the evidence. Conducting a needs assessment. Okay, so you're trying to identify a need, and you're going to use an instrument to collect information that, once you review and analyze that information, it's going to identify the significant areas of need. So again, you need to understand your analysis process. Planning and evaluation. So we will eventually get to a point where we start to develop our program objectives, and they're going to be in a particular format that makes them a measurable objective. The measurable term is what's key here. That means that you're going to be collecting data, analyzing the data, and then assessing whether or not that objective was met. Generating evidence for a funding agency. Again, you may need to analyze data, present results to a funding agency so that they see there's a potential for a return on investment, right? They invest these funds into your program. What are they going to get out of it? Well, you're going to have to use evidence to kind of help them see what the benefits are going to be from your program. Interpreting program results, right? You're going to have to demonstrate whether or not your program was successful. How are you going to do that? Through data analysis. Okay, so here's what I was talking about before when I was talking about creating categories and that sort of thing. So four basic types of data. Right, so you have this instrument that's going to collect data. Well, we also have to consider, well, what type of data are we collecting, because that's going to impact our selection of statistical analyses. All right, so the most basic type of data is nominal. Right, this is just strictly categorical data. Right, so the question, what's your favorite color, red, blue, or green? Right, that's nominal data. What is your gender, male, female? That is nominal data. Do you work out 3 days a week? Yes or no? Nominal data. That means that the results, the data you collect, has no inherent numerical properties. Right? So again, you're limited on the only numbers you can generate from that are, well, how many people selected red, how many people selected blue, and then we can apply non-parametric statistics to tell us if the numbers of red, the numbers of blue are statistically different. Okay, just looking at them and say, okay, well, I had 35 in one, 37 in another. Yeah, numerically that's a different number, but we have to apply statistical analyses and get that p-value, that probability value of less than or equal to 0.05. If we have that, along with the viewing that the numbers are different, then we can say that they're statistically different. Okay, ordinal. Ordinal is similar to nominal in that you have categories with no numerical value. However, there are rank order differences across the categories. For example, if you ask the person to select the appropriate age range they fall into, and we have 18 to 21, 22 to 24, 25 to 26, 27 plus. Now, if a person selects 18 to 24, okay, we don't know exactly how old that person is. We know that they could be 18, 19, 20, 21, 22, 23, or 24, but they fall into that category. So that's what makes it non-parametric, because we don't know the difference between someone that selects 18 to 24 and someone selects the group 25 to 28. We know the person that selected 25 to 28 is older than the person that selected 18 to 24, but we don't know how much older, right? Because the person could be 18 and select that 18 to 24 category. The person could be I don't know what the range I used, 29, and selected the 25 to 29-year-old, right? So in that case, there'd be 11-year difference. Or the person could be 24 and select the 18 to 24 category, and the other person could be 25 and select the 25 to 29 category, and there's only 1 year apart. The point is, just by giving the age ranges as data, we don't know the exact difference or interval, so therefore it's non-parametric. Okay, now we cross over the line into parametric level data with interval. So here we're dealing with numerical values, and we know the interval between each value, right? So if we have numbers 1 through 10, We know the difference between 1 and 3 is 2 units, but we also are working with consistency. So the difference between 7 and 9 is also 2 units. That consistency is what allows us to apply mathematical calculations to that data. Now, the fourth type is actually a type of interval data, and we call it ratio. The significance of ratio is that there is an absolute zero. That means zero is the absolute absence of value. There are no negative numbers. Typically, a lot of physical measurements utilize ratio. For example, height. Okay, height starts from the floor and works all the way up to the top of your head. So your height at the floor is 0, right? And then we go from there. There is no negative value for height in this particular example. Same thing with temperature. Now temperature gets into it because there's Kelvin and things like that, but as long as 0 is the absolute lowest possible value, then we know we're dealing with ratio. So it's a subtle difference between interval and ratio, because ratio is actually a type of interval. There's still that consistency of differences between each unit. But here I want you to key in on, if there's a true null value or an absolute 0, that should be your prompt to select the ratio data types. And again, your instrument collects data. It's up to you to determine what type of data that instrument is collecting, and if that type of data aligns with what you're trying to do statistically. One thing, and I've mentioned this before, you can convert ratio and interval data into ordinal or nominal categories, but you cannot convert nominal and ordinal data types into interval or ratio data. And because nominal and ordinal data is non-parametric, it really ties your hands on what appropriate statistical analyses you can perform. Unless you're absolutely sure you need nominal or ordinal data to fulfill your statistical analyses, I always recommend you reword a question to collect an interval or ratio data type, and if need be, you can go back later and recode that data or compute new variables that are ordinal and nominal. For example, you can ask the question, do you work out 3 days a week for 30 minutes a day, yes or no? Okay, you've just collected nominal data. If you ask the question in a different way, if you say, how many days per week do you work out at least 30 minutes? All right, at that point, they can respond with 0 through 7. Okay, a 0, right? We can convert that into a no. I do not work out. Okay, and anything greater than 0, 1 through 7, right? That would be a yes, I do work out. So you can convert from the higher levels to the lower levels, but you can't go the other way. The other thing to keep in mind is ratio. Anytime there's an absolute 0, that's how you know we're dealing with ratio data. Okay, so if you like, you can go through and try to determine what type of data will be collected based on these questions. If you want to put it together and send me an email, I can look it over and see if you're on the right track. One thing I do want to point out is the last bullet. So this is an example of a Likert scale. So the question is, I would feel comfortable planning a health promotion program for a health agency. And you can use this as ordinal, or you can use it as interval. Now that's kind of controversial. You have on one side, people say these are mutually exclusive categories. On the other side, it says, well, your level of agreement is on a continuum, and we can utilize a numerical format. And the difference here is, instead of using non-parametric, where you would just compare the number of people that selected strongly agree compared to the numbers that selected agree, neutral, disagree, strongly disagree. Another technique is to assign a numerical value to each of these responses. So typically you'll see strongly disagree is coded as a 1, disagree as a 2, neutral as a 3, um, agree as a 4, strongly agree as a 5. And once you collect all the data from everybody, for each group, you can collect or calculate an average, right? So you would just add up the numerical values you assign to the categories, right? And then calculate an overall average. Then you can do parametric statistics. That's the one thing I'll say about that. But go through these and see if you can determine the appropriate type of data that you would collect. And then here's some more. Again, if you want to throw them together in an email, send it to me. I'll take a look and give you some feedback on that. Okay, so what are some other key things you need to consider? All right, so now we're talking about the instrument, the thing that actually collects your data. And I've mentioned this term, psychrometric qualities, before. But basically, when you consider psychometric properties, not all instruments are created equally. Some instruments are kind of thrown together, and there's going to be a hit to the psychometric qualities of that instrument, rather going through kind of a structured approach. And right off the bat, I want to say that when you're putting together an instrument to collect data, it is never simple, right? You just don't want to throw together a bunch of a collection of questions and call it an instrument. Well, I mean, you can do that, but your psychometric qualities are going to be nil. How do you establish psychometric qualities? There's a lot of statistical analyses that you can do. There's comparisons with established instruments that you can do. But for right now, just know that instruments aren't created equal, and some are better than others in terms of psychometric qualities, and you want to strive to utilize those that have demonstrated high psychometric quality. Now, what are the things that we're going to consider? So reliability and validity are really what we're interested in. The fairness basically is addressing whether or not there is bias built into your instrument. Bias would be, there's several types of bias that you could introduce, but it's something that is influencing the data before you get it. So like I said, you may get your results back and you go to analyze it, and you can analyze data, forward and backwards and get your results. But the quality of that data, is it really indicative of what's going on in your population, or does the instrument kind of push the data outcome one way or another? So let's get back to reliability. So reliability is consistency. Basically, you want to be able to rely on that instrument returning the data that you want it to return, and you want it to do that repeatedly. Every time you use it, you want it to be able to return that level of quality. Validity is accuracy, right? So if you ask a question, you have an intention, on how that question should be interpreted by the respondent. Well, it's not guaranteed that the respondent, when they read that question, they're going to interpret it in the way that you intended it. That's the measure of validity. The closer the two of you are on the same page, the higher the validity, the higher the accuracy. Okay, types of reliability. So how do you establish reliability? Well, there's several different ways. Internal consistency. Okay, checks if items on the instrument are measuring the same research domain. So from a statistical analysis standpoint, you need to collect the data, and then you analyze the data to determine types of reliability. For internal consistency, typically we use what's called a Cronbach's alpha, and it's simply a statistical analysis that looks for patterns of how people respond on different questions. And the idea is that the different questions relate to some type of domain. So maybe a question is on, you're trying to measure something about attitude towards a behavior change, and you have multiple questions that try to assess that. Well, if you ran a Cronbach's alpha, or you're trying to establish a turtle consistency, all those questions that pertain to attitude towards the behavior should group together numerically. And there's a lot that goes into the actual the analysis, but from a software standpoint, it's just a couple clicks. Okay, stability reliability, right? The same instrument is used to measure the same group of people under similar or same conditions at two different points in time. So the idea is that if we have a stable domain, attitude towards the behavior, right? Nothing has happened to that individual. They had the same attitude at the beginning of the program as they do at the midpoint. Well, stability reliability is sometimes called test retest. So basically, if their attitude's the same, then the instrument should be able to detect that. So if they took a pre-test and a post-test, those scores on attitude should be very, very similar. Again, we're creating a situation where nothing has happened to change that individual's attitude, but the instrument has the ability to measure attitude consistently, so we would expect the same scores if, again, attitude didn't change. Rater reliability, we have intra-rater or inter-rater. The difference between intra and inter is that the number of raters we have. So what's a rater? So say I sent out a group of students and I wanted them to count the number of students that walked by them in the breezeway with blonde hair. High rater reliability would be each person that's out there looking for people with blonde hair to account for them has the same interpretation of color. There's different shades of blonde. Some are darker, some are lighter, right? You want to make sure all your raters that you send out there are using the same kind of cutoff points, right? At what point does blonde stop being blonde and starts to become brown? Okay. Well, everybody that's out there making this assessment needs to be on the same page. So the closer they are together, the higher your rater reliability. The further they're apart, the lower your rater reliability. And then finally, equivalence reliability. So if we look at the definition, focuses on whether different forms of the same measurement instrument when measuring the same subjects will produce similar results. There's a number of different ways you can do this, a number of reasons why, but the most common reason is when you're engaged in an effort to shorten your instrument by reducing the number of questions in the survey. It's no secret that people are more likely to complete a short survey than a long survey. So sometimes what people do is they'll develop an instrument and then they'll start to think about, well, could I shorten this instrument and still have the same ability to interpret the results and say something about the sample? Sometimes you'll see this listed as okay, so I have a survey that I use. It's called the Drinking Motives Questionnaire short form, and the short form it's an item that basically, or an instrument to assess the motivations of the individual to consume alcohol. And there's I think initially there was 36 questions on the original DMQ. Then the researchers went back and they conducted some studies to see if could I reduce that number. And I'll just mention this, but they use factor analysis to group the questions and to assess whether or not the psychometric properties established in the DMQ carry over to the DMQ short form, which is 12 questions. And so the idea is that, well, I want to use this shorter instrument. Well, you need to demonstrate that the shorter instrument does the same thing as the original instrument. So comparing the two, that's where the equivalence reliability is established, right? The more similar they are, the higher the equivalence reliability. The further apart they are, right, the lower the equivalence reliability. Types of validity. So again, we're trying to assess accuracy of our instrument to collect the data that we want it to collect. We can establish validity in a number of different ways, and they're all different approaches. But just understand, and I'll talk about this as we go through, not all forms of established validity are equal in terms of quality of the accuracy assessment. So at the very minimal, you want to conduct face validity. And basically you complete your instrument, you approach a colleague that you feel is maybe they have expertise in designing instruments, or maybe they have expertise in the health domain that you're trying to assess. But basically you're just having them, you're explaining to them, okay, here's the purpose of this instrument. Can you look through it and just see if you see that the instrument aligns with the purpose? And basically they're just going to look through for readability. Are these statements concise, or are they ambiguous? Does it make reasonable sense that, okay, this question would tell you something about the respondent, and it matches up with kind of what you want to learn about the respondent. So it's strictly based on opinion. So that's the lowest form of validity. Just up from that, so now you're convening a panel of experts. So people that you recognize, maybe they have, they're experts in psychometric properties, maybe they're experts in health-related topics, maybe they're experts in both. And again, you're giving them your purpose, but probably more detail. Okay, here's what this question is supposed to be asking. Here's how these three questions kind of interact and work together. And then charged with that, the panel goes back and really digs in and assesses the quality of your instrument. Again, this is based on opinion. Now we're dealing with a little bit more of a rigorous opinion, but it's still based on opinion. So face and content validity, I both consider them as something that, yeah, these are things you should be doing, but you're really not establishing a very rigorous assessment of validity. Okay, so what can you do to establish validity in a more effective way? Again, several ways you can do this. So with criterion based or criterion related. So the key here, and if you go to the book and read it, you see that they mention gold standard. So what a gold standard is an instrument that's been identified as something that's very valid, very reliable. Maybe it's been around a long time. Maybe it's been used in many different studies, and kind of the overall opinion of this instrument is that it's a high quality, it's a go-to type of instrument if you want to assess X, Y, and Z. Well, if your instrument that you design, right, it attempts to measure the same things that this gold standard does, then that means that your results should be correlated. Now, if the gold standard, predicts future behavior in your instrument, right, you're asserting that it measures future behavior, then the two should be highly correlated. If they're highly correlated, then we could say we've established predictive validity. It's very, and concurrent validity is very similar, except that, okay, well, the gold standard is measuring these characteristics at a point in time. Well, if we take our instrument and we measure at that same point in time for the presence or absence of certain characteristics, then again, they should be highly correlated. The correlation, that's a statistical analysis, so that's what really gives us more faith in the validity assessment. Concurrent validity. Very similar to criterion related, except here, concurrent validity, we're taking our instrument and we say that, okay, well, if you look in the book, they talk about depression. And based on this instrument, if you fill out these questions and we create a profile, then we should be able to assess your level of depression. Well, if that assessment returned by that instrument matches up to, say, a clinical diagnosis of depression, right, and they're correlated, then we can say there's concurrent validity. They're related and they move in the same direction, and the correlation is statistically significant. Construct validity, same thing. We're trying to compare a known valid instrument with, a suspected valid instrument. But what we're comparing with construct validity is the actual construct. So what is a construct? A construct is an operationally defined concept or idea. Okay? For example, if you have this idea or concept that if a person is confident in their ability to carry out a behavior, then they're more likely to carry out that behavior. Okay, that's the idea. Now we have to put that in a form that we can work with in terms of programming around that idea or assessing that idea. So we say that, okay, we'll take that idea that confidence is associated with actually performing the behavior, and we're going to say that it is called self-efficacy. Right? And if you go and look up the definition for self-efficacy, it's that one's confidence in their ability to carry out the behavior. So we have this construct of self-efficacy, and we come up with several items that, depending on how the respondent answers those items, we look at them collectively as a representation of their self-efficacy. So there are many instances where instruments have attempted to measure self-efficacy. It's a pretty common construct when we talk about behaviors. Again, we compare that section of our instrument, the section that measures self-efficacy, we compare that with another measure of self-efficacy, and they should correlate either positively, right? We call that convergent validity, or if they correlate negatively, meaning that they move in opposite directions, that would be discriminant validity. And then finally, sensitivity and specificity. So if we look at the bullet, it says sensitivity in parentheses, those with; specificity, those without. Again, go to the textbook, look at the example, and when they just talk about sensitivity, it's the ability of the instrument to detect positive cases. Okay, and specificity is the ability of the instrument to detect or discriminate for negative cases. Sensitivity basically addresses false positives. Okay, the greater the sensitivity, the less likely you are to have false positive. Specificity addresses false negatives. The higher the specificity, the less likely you are to have false negatives. Okay, bias. Look at the definition. Biased data or distorted data often caused by the way they are collected. Right? That's going to be response bias. So we want to make sure that we're not doing anything, or the characteristics of our instrument isn't doing something that's going to influence the way a person responds to that question. If it's something that we're doing as we collect data, I had a project one time. I sent students out on campus to recruit people to participate in a survey. And one day, the group of students that was assigned to collect responses, I came back and I started analyzing the data by that particular date. I noticed that it was predominantly female respondents. When I looked at the other groups that did this, right, it was a mix of male and female. So I went back to the group and I said, explain to me how you would approach people and recruit people into this study. And they're all males in this group, and basically they got into um, kind of a competition who could meet the most females that day while collecting data. So they would only approach females to complete the survey. Well, that's a problem. You're introducing bias because I'm only getting the female perspective on those responses. And had I not just kind of happened to notice that this one, there was a gender disparity in the type of response, I would have never kind of keyed in on this. And if my outcome was really dependent upon gender, then that means that that portion of data could have been biased towards a certain set of responses that maybe wouldn't have shown up if there was a heterogeneous mixture of gender in the sample. Um, and there's all sorts of different ways that you can introduce bias, not only in collection but during analysis. Um, there's a form of bias called social desirability, where a person may be reading a question, and instead of responding how they truly feel, they respond based on some perception they have of, okay, well, this would be more socially acceptable if I responded this way instead of how I truly feel. That can happen. So you want to make sure that your validity isn't being compromised by something that you're doing or some nature of the instrument that's introducing bias. So that'll conclude part one, and I will upload part two, and I'll continue on with this particular lecture.